Good afternoon, everybody. Thanks for all those who are joining online and in person. I would like to welcome you all to Project Echo. This is a program that Dr. Santos and me have been hosting it for almost a year. And this initiative hosts monthly sessions with healthcare professionals and specialists from their Health Science Center. And this is to educate both the primary care physicians, the PAs, the nurses, the pharmacists, and other healthcare professionals in rural and underserved areas of West Texas. Here, you may occasionally receive emails of our Project Echo team inviting you to host a presentation or participate as a panel specialist in the future to keep an eye on any exciting opportunities. I would like to know, I would now hand over um, the podium to Dr. Prabhu, and she's going to talk to us on strategies that rural physicians can use to improve healthcare delivery for underserved population. Before I hand over, I would like to also mention that this is a program and educational activity that is supported by the Texla Telehealth Resource Center, which is a federally funded program by F. Murray Hall Rural and Community Health at TTUHSC. And now I give it to to the second year student, Mr. Nimra, who will present today's case.
All right. Good afternoon, everyone. My name is Nimer Al-Nimri, and today we'll be talking about the strategies that rural physicians can use to improve healthcare delivery for underserved populations. And the main case presenter will be Dr. Fiona Prabhu, but I will be introducing the case for now. So for our case, we have Mr. F, who's a 60-year-old male with past medical history of hypertension and presents with a follow-up after a recent ischemic stroke with left-sided weakness. So their past medical history includes a 20-year history of hypertension, in addition to a recent ischemic stroke of about 2 weeks ago, and they present with left-sided arm and leg weakness. Their allergies are not mentioned, so they're a no known drug allergy patient. And for their social history, they live in Muleshoe, Texas, which is, I believe, a rural city from here, I believe, northwest of Lubbock. And they work in manual labor at a dairy farm. They smoke roughly half a pack of cigarettes daily and drink a 12-pack on the weekends. They have limited healthcare insurance and they're not eligible for inpatient rehabilitation. And their family history is unknown. So for their medications, they take hydrochlorothiazide, 25 milligrams daily, losartan, 100 milligrams daily, and ticagrelor or Brilinta, 90 milligrams daily with a 90 or 30-day supply and no refills. However, they do need this for a total of 3 months minimum. They also take rosuvastatin, 20 milligrams nightly, 30-day supply and no refills. For the review of systems and physical exam, they still have left-sided arm and leg weakness due to the post-stroke deficit, and all other examinations appear normal. As for the labs, there's nothing abnormal beyond their current hyperlipidemia. And for our assessment, it's pretty consistent with the case presentation of an ischemic stroke with left-sided weakness, hypertension, and hyperlipidemia. So the plan that we'd like for this patient is to have an outpatient physical and occupational therapy, follow up with their primary care provider within 1 week, coordinate therapy services, and monitor and refill medications. So for the main challenge and question of this presentation is, what challenges do you foresee in taking care of Mr. F post-discharge from the hospital? And while y'all think of answers or brainstorm, I'm going to be introducing Dr. Fiona Prabhu. And she completed medical school at the Texas A&M University in 1995 and completed her residency training at the TCOHSC School of Medicine here in Lubbock in 1998. And in addition to that, right after completing her residency, she was hired by the Department of Family Medicine to stay on as faculty, completing her fellowship in 1999 and promoted to full professor in 2022. As for her distinctions, she's a fellow of the American Academy of Family Physicians since 2005. She's also a Lubbock Bankers Association professorship for community outreach at the student-run free clinic since 2015. and she's also a member of the Gold Humanism Honor Society since 2017. As for her current she's currently serving in the following roles with ongoing research interests in the same areas. And she is a co-medical director of the Free Clinic at Lubbock Impact since 2011. She is also a faculty advisor for the Family Medicine Interest Group and co-faculty advisor for the Gender and Sexual Alliance Group at the TTUHC School of Medicine. Lastly, she's a faculty advisor for the Service in Medicine elective and clinical practice with Underserved Populations elective. And with that said, ladies and gentlemen, Dr. Fiona Prabhu.
I just got a quick question about the case.
Yes.
This is a stroke, and we need to know if this patient is right-handed or left-handed.
Okay, so they are left-handed.
Okay. So it's a dominant hemisphere stroke.
Correct. So let me go back. So what are some possible challenges that you can foresee in taking care of this patient? Medication refills.
Communication, writing, speaking. The exam it just said left hand or arm and leg weakness, but we didn't have any information about speech.
Right, they can still speak, but they do have arm and leg weakness. So the written communication is an issue. They also are originally a manual labor, do manual labor at a dairy farm. So we're not sure what their literacy level is as well. And being able to read and write clearly is definitely a
far-
concern.
How far away from Lubbock is their hometown?
How far away from Lubbock is? I think it's at least a 2-hour drive, if not longer.
So I foresee
How
an
long-
issue with how they'll get outpatient physical therapy,
Yeah.
being that they're underfunded and it's a long distance from Lubbock.
Yes. So lack of funding, further distance away from Lubbock. So challenges in getting physical therapy arranged.
And is the patient able to drive?
No, the patient is not able to drive. So yet another concern is transportation.
Do they have caregiver at home or someone that's there to help them?
No, we don't know that. So again, concern about what their support is in their household. Those are all good considerations. So other things we came up with when we were developing this case, so high cost of medications, risk of non-adherence to medications because of the cost. They continue to smoke. Well, now that they're back from their hospitalization, I'm sure they'll go back to smoking potentially and continue to drink their 12-pack, even if they've been counseled. The list possible low health literacy, limited understanding of their stroke recovery, risk of post-stroke depression, emotional distress because of that. That's a high risk post-stroke. Need for close follow-up for stroke management and secondary prevention. And again, how are we going to get them that follow-up if they're a couple of hours drive away from Lubbock itself? Social and lifestyle challenges, they are a manual labor and they can't work. So how are they getting any kind of income? I doubt that they have any savings or money in reserve. So how are we going to get them housing potentially, medication assistance, even just basic things like food security? And then what kind of support are we going to be able to give them for encouraging active lifestyle changes such as quitting smoking and quitting drinking alcohol? And then again, limited access to physical and occupational therapy in a rural area and lack of insurance coverage because of they qualified for inpatient rehab, but they couldn't afford it. And there was no necessarily charity programs through inpatient rehab to cover that. Transportation barriers for outpatient appointments was brought up, and then poor care coordination potentially between the hospitalist and the local care providers, and limited access to specialists, and limited rural healthcare resources overall for financial.
one more thing. So with a dense motor impairment, dressing and bathing can be very problematic.
Yes.
Is the patient able to dress himself and bathe himself?
And that's important considerations. So we did not go to that extent, and that's what physical therapy needs to help us with. But there's definitely potential for not being able to dress yourself, bathe yourself, or get to a toilet in a timely manner. So what kind of equipment do they need at home in order to get to basic self-care skills? So that's kind of the baseline case. So before we start, we're going to talk about some demographics of the rural population. So the mortality in rural America is increased, 134.7 excess deaths per 100,000, which is a nearly 20% disparity compared to urban areas. Life expectancy is approximately 3 years lower, and they have a higher stroke and cardiovascular mortality, as well as a higher maternal mortality, much of which is due to underlying cardiovascular disease. This one is in the state of Texas, so the lighter colors are the lower life expectancy, darker colors are higher life expectancy. So you can see in life expectancy by county in Texas that there are some definite discrepancies based on which county you live in. And with this area in what Southwest Texas being the worst. But Amarillo's in the lighter colored area. Lubbock is probably around here somewhere. And again, discrepancies based on whether you live in big urban centers or smaller rural areas, even within the state. This is a map done by UT Southwestern. I went back to the website yesterday and it's down for maintenance, but you can get actual data based on what county you live in and what locations that they surveyed on life expectancy as well. So in Texas, the rural health facts, there are several hospital vulnerabilities, and 32% of rural hospitals are vulnerable to closure. 43% of rural hospitals operate on negative margins. There are health professional shortage areas, which I'm sure for anyone who's attended Texas Tech as a medical student is well aware of when it comes to that. There's 5 hospital conversions since 2010 and 19 hospital closures since 2010. So that means increasing volume of people sent to the bigger cities that have more infrastructure. In 10 of the counties surrounding Lubbock, 4 of them have critical access hospitals, 5 of them have limited service, and 1 doesn't have a hospital at all. This is just some graphics on health profession shortage areas for physicians, primary care. So none of the county is in a shortage area is the light blue. At least part of the county is in a shortage area, kind of the medium blue. The whole county is in a shortage area. And so these are kind of the surrounding areas which we serve. We can also look at advanced practice nurses. And again, there's nurse anesthetists, nurse practitioners, and the total advanced APRNs in rural for metro versus non-metro counties. So metro is in the light blue, non-metro is in the dark blue. So you can see there is a significant discrepancy even among advanced practice providers. And again, PAs, the metro versus non-metro counties. So even if you look at other healthcare providers than physicians, we're still underserved in all these areas. Again, more demographics. How many physicians do rural areas need to equal urban patient to provider ratios? So Texas ranks number 6 with a rural physician deficit of 242 per 100,000. So North Carolina being the worst of the list. And among the top 10, West Virginia is better than us, a little bit better than us. Rural Texas counties are more likely to fall into the bottom quartiles of the length of life in clinical care domains. And again, because we brought up these factors a few slides ago, declines in rural healthcare provisioning in Texas will have hospital closures, provider shortages, lack of Medicaid expansion, although that's going to be an issue across the country, reduced social programs, and budget restrictions. They have attempted some solutions. So rural medicine residency programs, establishing community-based micro-hospitals, relying on community health workers to deliver in-person and virtual health services. And we do have the CPRIT program, the Cancer Prevention Research Intervention Treatment Program for breast and colorectal cancer screening. So what do you think are current resources out there for rural healthcare in West Texas? What do you know about the resources available?
Dr. Prebu, this is LaMicah Hogan. Nice to meet you. Thank
Hi,
you for
how are
what
you
you've-
doing?
Good, good. I guess I'm your token nurse practitioner on here today. Thank you for what you said so far, but you said, what are the current resources in rural health? Well, I work in
Yes.
Lynn County when I practice, and I can say that there are a lot of really wonderful resources available to us, but they're inconsistent.
Yes.
And I would say there's a lot of things that we have in rural health, but they're inconsistent. You know, sometimes they're just hit or miss, and a lot of times that comes down to payer source. That's just my view from that particular seat. So,
It's a good view to know because you're actually doing the work in those counties. Other people know current resources. Okay. So first of all, we do have an organization in Texas, 211texas.org. So we have it for different cities also. Contact 211 is a place that pretty much is a resource hub for all the outreach programs for different areas. So food security, housing security, transportation, those basic things can be, and assistance with medical insurance. And you can find different programs within this for your county or city based on clicking on that. So we can click on that if you want to see the actual website. And I'm not sure if that's showing up for real or not. I may have to switch inputs. Okay. So if you look at the homepage, if you want to get started, you can basically scroll down and see what some potentials are. Search for resources by physical location, zip code, or county. If you want a specific program, that's another thing to do. And then you can add or edit your listing. There's mental health resources, housing choices, inpatient care. So some of the things that you might want to look at based on what community you're sending your patient home to. So another thing is the Texas Department of Health and Human Services. They have money for county indigent health care, and you have to meet eligibility criteria to receive some financial assistance. And I apologize for the way the spacing looks. But you have to live in Texas. Your income is at or below 21% of federal poverty guidelines, and you have additional resources of less than $2,000. So, you know, this also can apply to the Lubbock County Medical Indigent Program. So if you have any kind of property, even if you're not able to use it, it's not developed or anything, if you have a vehicle and it's valued at more than $2,000, you're not eligible. You're not also eligible for Medicaid. So you must meet all 4 criteria in order to receive county assistance. And then this is the federal 2025 poverty guidelines for the United States. So in a single household, you must make within 21% higher or less than $15,650. So and then subsequent up to a family of 8. These are the cutoffs. Services that they can receive, they can get vaccines, medical screening services, yearly physical examinations, inpatient and outpatient hospital visits, laboratory and radiology, and some skilled nursing facility services. But if you don't necessarily have a community with a skilled nursing facility, then that's a challenge. So here, if we look, there's varying programs through the state of Texas for providers. So there's some services, just like Lamika talked about, that are well covered and others that are not, so very intermittent. So you can see we have breast and cervical cancer services, case management providers for children and pregnant women, children with special needs, CHIP perinatal providers, the county indigent healthcare program providers we talked about, epilepsy, family planning, healthy Texas women, hemophilia, kidney health care, supportive palliative care, prenatal screening for domestic violence and substance use, primary health care services, Texas abstinence education, Texas Health Steps providers, which are really typically well child checkups, Texas Medicaid and healthcare partnership providers, and Title V maternal and child care fee-for-service programs. And then there's some long-term care provider assistance as well, but not every clinical condition is necessarily covered by these resources. So facility-based programs, based on whether your community has assisted living facilities, daycare, day activities, intermediate care, nursing facilities. There may be community living assistance and support, deaf and blind with multiple disabilities, home and community-based services, medically dependent children, Texas home living. Again, the whole listing of community-based programs. But looking through here, how many do you see may potentially apply to our patient? So again, limited coverage for certain specific diagnoses. Potentially aging and disability resource centers. Potentially consumer managed personal attendant service. There is a program, at least here in Lubbock, called Community-Based Action, where if they do have a family member who's willing to provide that service, they will provide some financial support. Once you can talk about all the resources that the person needs to be a caregiver within their own family home. There's also a big need for behavioral health services as well. So our patient is potentially at risk for depression, major life changes because of this stroke. And adjusting to that is a big issue. Plus he has a history of drinking at least a 12-pack on the weekends. So we don't know necessarily if there's other substances, if he's drinking more than that, what are kind of his resources to be able to have the support to be able to quit some of these habits. So there are some resources to help behavioral health providers, consumer operated services, coordinated specialty care if you have psychosis, ECT, which I think we finally have someone to provide ECT at UMC, but we had a provider for many years who could give that service, and then they moved. And so Lubbock did not have anyone to provide electroconvulsive therapy services. But local mental and behavioral health authorities, permanent supportive housing, prevention and behavioral health promotion, transition from homelessness. So all these are more mental health based services as well. Who's heard of Needy Meds? Who's heard of patient assistance programs for drugs? All of you have heard of that, okay. Who has completed patient assistance medication forms for patients? Show of hands, raise them higher. They actually don't take that long for you to complete as a physician. The patients have to provide proof of income. So one of their concerns was Brilinta. So Needy Meds, let me pull this up. So it is a website that has collected all the medications that have patient assistance programs. And they give you either discount coupons, they give you a form to complete for your patient so that you can get them the drug. And sometimes they give the medication directly mailed to their house, or they give them a card for them to take to a pharmacy to get the medication. Okay. So we have Brilinta that appears here. And then take the headache out of this. Okay. Let me go back to my other link that was more direct. So here you can see that there are Brilinta samples that you can request potentially for your patient to continue, which is probably what the hospital did when he was discharged, because they have hospital-based programs where they can give him a 30-day supply. There's different studies that have come out about the length of time that you continue Brilinta for a post-stroke patient. So it can range anywhere from 30 to 90 days or up to a year. So it depends on what your latest recommendations are and whether you know that there's actually a generic available, and are you comfortable switching to the generic for this patient? If you're not as comfortable with stroke management, then you really want to know if that's okay or not for your patient. There's also mail order reimbursement. And then there's a Brilinta savings card. Eligible commercially insured patients with no coverage for the drug may only pay up to $5 per prescription. So this is a pretty useful website, and you have a lot of patients on more expensive medications, and this may be a source of ability to pay for some of this for them. So another thing that when I'm co-medical director of the free clinic at Lubbock Impact, and I often ask the students to make sure they download the GoodRx app. And this tells you the cost of drugs in your local community and tells you the best places in town pharmacy-wise, because there's a wide range in pricing sometimes. So they have an app. If your patient has enough space on their phone, they can download the app, show the coupon to the pharmacist. Most pharmacists are too busy to be able to tell their patient there's potential discounts. So sometimes it's wise to just talk to your patient about what are some ways to save money, get this at a lower cost so you can afford to continue to take your medications like you're supposed to be able to. So this one, for example, is Brilinta. And obviously, that was just taken a snapshot I took like 1 week ago about the pricing, even with the GoodRx coupon. So anywhere like $558 retail price at these pharmacies, and you get maybe $100 off. But also there is a generic equivalent for $32. So I did not click on that particular one to see, but these are all local pharmacies and they will tell you the cost of these drugs. So if $32 is more affordable for a month compared to $458, it's worthwhile letting your patient know that these are out there. And I frequently have GoodRx cards mailed to our office. And several physicians on the faculty get them, and they all end up in my mailbox. If you have those display boards in clinic with patient education, we have those in our clinic when you enter on either side of our clinic for patients. And they have GoodRx coupons as part of those display plastic holders. So another issue is potential transportation back and forth. Who knows about Spartan? One person in the crowd. It's good to know. But it's basically a transportation service that can take your patients from smaller towns to Lubbock or other cities where you've had your care to specialty appointments. So that's another potential service patients can get signed up for to be able to go back and forth. And this is something I found when I was looking online for potential clinics. So South Plains Rural Health, and these people, click on the actual active link. Yes. Micah, LaMicah, you had a question? Not yet? Okay.
That was an error, sorry.
Okay. So let's look at providers. These are different people in federally qualified healthcare centers. So at least we're getting representation from advanced nursing practice providers, even if there may not be physicians. We'll look at family medicine since that's my field. Why should I visit a family doctor? What can they treat? I know they had a clinic talking about other healthcare resources. So there's a South Plains Rural Health Food Bank and Community Garden. And so they have a clinic in Levelland. And so they have some resources to at least set up a physician or a primary care person. Okay. So Nimmer's going to tell us a little bit about some telehealth resources that we have available. And you can come back up here if you want. Okay.
Okay, so now it's kind of, let's take the approach of how we can introduce telemedicine and how it's being applied in West Texas in order to help minimize hospital readmissions and having further issues with patients. So I guess the most major way could be just implementing telemedicine programs into the typical clinical structure. An example of this would be telestroke, which is often like how telehealth plays a vital role in terms of allowing counseling with neurologists and helping local emergency departments to determine whether to administer medication or bring the patient in for an inpatient setting. And an example of this, how it's being applied to here in West Texas, is the Texas-Louisiana Telehealth Resource Center, which focuses on rural areas in West Texas and I believe just the general rural regions in Louisiana. And for the Texas Tech Physicians Virtual, this is actually here, I believe, at the pavilion, where you can book virtual appointments with specialties of various interests and for various reasons. And also the Frontiers in Telemedicine, which was established during the COVID time. And that allows for certification in telemedicine and it kind of bringing providers a basic introduction into it and how to integrate it into their clinic. And another way you can apply telehealth is through remote monitoring and virtual nursing. An example of this could be RPM platforms to track patient vitals, such as their blood pressure, glucose levels, and medication adherence from home. And they help manage risk factors and support ongoing stroke prevention. And this can be further enhanced with virtual nurses that can support these types of patients through education, monitoring vitals, reviewing medications, and follow-ups. And this is specifically kind of to help minimize hospital readmissions and extends the care to the patient's home, which, because transport is a very big factor to account for here in West Texas. An example of this is the TTUHSC RPM program, and I believe they collaborate with Nurse on Demand in order to have the nurses provide all these care options to the patients. And another way is through virtual rehabilitation platforms and access to behavioral health. Examples of these could to provide like remote physical occupational speech therapy. And this can often also include emotional and cognitive health and post-stroke care and connecting patients with licensed behavioral health because typically patients that have stroke do have a tendency to, because it can impact their mental, especially if their functional has been limited by some extent from the stroke. Examples of this are Neuro Rehab VR, which is using or integrating virtual reality in order to help the patient kind of restore some function through just physical therapy at their home. It's certainly more limited and has other issues such as connection and otherwise, but it's a good resource for those that specifically struggle with transport to main facility centers for that. Another example would be the TTUHSC Telepsychiatry Initiative, which I believe as of the end of 2024 is in collaboration with at least 12 programs or other healthcare clinics here in Lubbock to provide psychiatry care for patients. And lastly, as simple as it may seem, it's also very important to not just use any platform that provides video calls or calls, but rather ones that are specifically tailored with medicine in mind in order to provide that HIPAA compliant communication tools and also integrate smoothly with other RPM programs and virtual nursing and so on and so forth. And very popular examples of these are Zoom for telehealth or for healthcare, Doxy.me, and ClickSoft. And with that said, thank you guys. And here are the resources. And if anyone has any questions, please let us know.
So obviously our case was basically made up to kind of highlight some of the needs that are out there. And we do have those challenges, and I mostly do my hospital rounds over at Covenant Medical Center. We get patients from all outlying areas as well. And a lot of the times, if they do have a long-term care facility, patients can get some charitable care options for being admitted to skilled nursing facility for rehab, and that nursing bed can swing over status into a skilled nursing bed. And then we can potentially get home health out to his home. And then if we do have, a lot of the times the case management works with us from the hospital setting and helps us be mindful of what type of equipment the person will need. So if they have limited resources, they do have some charitable care options for them to get what they need. And obviously, if there's a neurovirtual rehab, they have to have the infrastructure inside their dwelling in order to take advantage of that. So that's kind of it for the case. You're welcome.
We would like to thank Dr. Prabhu for this very informative session. And please do not forget to fill in the survey to get the CME credits. And next month, we have Dr. Tarbox, who will be leading the Project ECHO session. Thank you.
Thank you, everybody, for attending. If you'd be so kind of signing up your name and email for the in-person attendees, I'll send out a email thanking everybody for attending with all the resources provided by our reference librarian. They did a great help today, and hope you guys all have a great day. Thank you. On your desk, there should be a handout with the link for the CME evaluation. So please fill that out, and the credits will be on be available after you fill out the evaluation survey. Thank you, everybody.
One of the things, so what he does with this, one of the things they do is the preceding story. So it's not the quantum gravity AI. Well, actually, it's the same story, but they develop teleporting. And how did they do that? Well, okay, the wave functions, the electron